I have the privilege of working in both violence intervention and violence prevention. I see how violence is learned, and I see its aftermath. In my field, we know a few things to be true. We know that interpersonal violence is pervasive in our society. We know it is often chronic, creating long-lasting effects. And we know that all of it is preventable. We know statistics like 1 in 3 women, 1 in 6 men, 1 in 2 non-binary and transgender folks will experience sexual violence in their lifetime. We know that young people and children are particularly vulnerable to abuse. We know the more underrepresented a population is within our society, the more likely they are to experience violence, because violence is a tool of oppression. And yet, we know hope. We see hope in the eyes of survivors when they realize that someone is finally listening and someone cares. We feel hope in the ease with which young children grasp the prevention concepts that we are introducing to them, further cementing the idea that abusive behavior is learned. It's like catching a glimpse of a golden sunrise just beyond the jagged peaks of a tall mountain. Currently, we are standing in the wake of landmark research in childhood trauma, its effects on the body, and brain development. The Adverse Childhood Experiences study has shown us that when children experience psychological trauma such as sexual abuse, prolonged food insecurity, living in a home with domestic violence, or substance abuse, their physical health in both short and long term is affected in negative ways. The more trauma children experience before the age of 18, the more likely they are to develop serious, chronic, and life-threatening health conditions such as heart disease, diabetes, and cancer. Even with one ACE, people are more likely to experience substance abuse and suicide. And this likelihood just increases the higher someone scores on an ACEs test. With this research, medical providers have begun to ask their patients, "What happened to you?" instead of saying, "This is what's wrong with you." A new skill set is being spread into the professional realm too, bringing training, education, and the employment of trauma-informed practices to counselors, teachers, and law enforcement. And what's probably the most profound of this is that when researchers began to spread this information, they found that most people had at least one ACE, and many people had multiple. We also have research from experts like Dr. Linda Chamberlain and David Finkelhor showing us that brain development is often stunted by psychological trauma, making it difficult for children to transition into adulthood with success. Instead, the underdeveloped brain gets stuck in survival mode, making it difficult to make connections between the prefrontal cortex and the limbic system, or the logical side and the impulsive side of the brain. Children struggle to learn, to focus, to regulate emotions, and to adapt. In addition to this knowledge about psychological trauma, we also have a clear understanding of sexual abuse. We know the common tactics people who choose to cause harm use to build and manipulate trust. We have Center of Disease Control and Prevention supported risk factors for the perpetration of sexual violence and protective factors against it. We have a growing list of CDC-recommended evidence-based prevention programs and models. Essentially, we have a peer-reviewed roadmap to how to decrease interpersonal violence within our communities. And there's that hope again, right? We know what causes this, and we know how to make it happen less often. So, what are we doing with all this knowledge to prevent violence? Well, until recently, most of our prevention efforts have been based in response. I think of things like mandated reporting laws for child abuse, and monitoring or rehabilitating people who choose to cause harm in the hope that they will not recreate their crimes. I think of things like ongoing healing and support through therapy, or the sharing of resources and access to those resources for people who experience harm. These things are meant to reduce harm in targeted ways and provide an environment that is more supportive of survivors and also ends the stigma and normalization of victimization. However, none of these things is aimed at preventing the initial trauma from happening in the first place. This is the soft, dry towel after falling into a mud puddle, when a bright red cone to prevent you from falling into it would have been better. Even when I am called to a school to deliver prevention programming, it is often after there has been an incident. This reactive way of thinking is why sexual assault remains the most expensive crime in our country. Not only just financially, but in terms of the emotional toll, the time spent on resources, and the healing process. It is time to recognize that interpersonal violence happens in every single community in our country and beyond. I am asking all of us to shift our way of thinking to a proactive one, so that we may intervene in a life before it is altered. Now, some may say that this issue of interpersonal violence is too big to tackle, and I agree, it is not going to be easy. It is going to take all of us working together to make a difference. But there is hope in prevention. Let us remember, too, we also already have that roadmap. A study of effective prevention programs from Maury Nation and others in the public health world has put together a list of 9 principles of effective prevention, including repetition of messaging, appropriately timed delivery of information, and fostering of positive relationships and using those risk and protective factors. The newest research tells us that using the social and ecological model in key areas is effective when paired with these 9 principles. So imagine then growing an entire garden from a single seed. You need to tend to the health of that seed and the environment in which it grows. You need to foster relationships between beneficial insects and that plant and stop the harmful ones. You need to add protection and structure to your garden, timed enhancements, fertilizer to ensure continued growth and success. School-based programs when targeted to abuse and violence prevention, have proven to be effective in changing individual behaviors and attitudes. These things help our seeds. We have laws in our state and others, such as Aaron's Law, that support the implementation of these programs into our schools. But these alone are not enough. Like our seed garden, we also need to focus on relationship level and community level prevention to see real change at the societal level. In 2007, the National Center on the Shaken Baby Syndrome launched a campaign using extensive research from Dr. Ronald Barr to decrease and prevent infant injury and death. This was called the Period of Purple Crying. This campaign delivered specific information in a simplified way during pregnancy and also during the hospital stay after delivery. It gave parents simple and realistic skills to prevent harm. The campaign was widely successful and is still in place across the nation today. We could mimic this model and deliver knowledge and skills to parents to help them protect their children from sexual abuse and help them foster and nurture a healthy sexual development which stops abusive behavior from forming in children. Prevention is possible. Through prevention, we also receive hope. Though relatively new and still emerging, there is evidence suggesting the use of hope as a powerful motivator in social change. No matter the issue, most people want to believe things can and will get better. When people believe they can make a difference, they are more likely to act. In my experience, it's hope that enlivens the survivors that I work with. And it's hope that enlivens the students that I teach. So today, through this lens of hope, I ask you to imagine the what-ifs. What if we started treating interpersonal violence like the public health issue it is, and normalized conversations about it, about its intersections with substance abuse and racial disparity? and about its risk factors and protective factors. What if we truly move upstream in our thinking and shift our prevention focuses to ones that take action before trauma occurs? What if we start making connection, collaboration, community action, policy, and procedure the norm instead of the standout? What if we deliver education and training to parents surrounding abuse prevention before they even leave the hospital with their babies? What if we enforce accountability for those laws, mandating targeted abuse prevention in our schools, and incorporate evidence or research-based prevention programming within our health education requirements? What if we take action today? What if we start right now?